Tonight, a proposal that could dramatically change the battle against obesity. The Biden administration looking to expand Medicaid and Medicare coverage to include weight loss medications.
How big a deal is this potentially for your patients?
Oh, my goodness. This would be wonderful.
For now, Medicaid and Medicare only cover the popular drugs, including Ozempic, if patients are diabetic or have certain obesity-related conditions. People struggling with obesity alone are forced to pay out of pocket at roughly $1,000 a month. Dr. Lori DiMattia is an obesity specialist.
It's heartbreaking to have one specific treatment option be so effective and yet so expensive. It keeps it out of reach for many, many people.
The HHS says 7.4 million beneficiaries would qualify at a cost of $36 billion over the next decade. But there are obstacles. The Congressional Budget Office recently reported that a plan like this would cost billions more to Medicare than the administration projects. There is also a mandatory 60-day public comment period before enacting a new rule, leaving the ultimate decision up to the next administration. President-elect Trump's choice to run Medicare and Medicaid, Dr. Mehmet Oz, has publicly supported the use of weight loss drugs. But Robert Kennedy Jr., Mr. Trump's pick to head HHS, has argued lifestyle changes are the key to tackling obesity.
They're counting on selling it to Americans because we're so stupid and so addicted to drugs.
Dr. DiMattia recommends a combination of lifestyle changes and medication.
There's people who don't believe or agree that that is a disease, and yet it impacts over 150 other different illnesses.
What's interesting here, Lester, is that private insurers often follow Medicare. So if this rule is enacted, it could mean many more millions of Americans could suddenly get coverage for these medications.
Much bigger impact.
That's
All right.
right.
Stephanie, thanks much. Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.